Hi, my name is Fanta. Today I'm going to be presenting on neurofibroma, which is a benign brain tumor. Pathophysiology of neurofibroma is that the NF1 gene is deleted. Basically, the entire NF1 gene is missing. So, neurofibroma is a genetic disorder of the nervous system that it causes tumor to form on the nerves in the body anywhere, anytime the tumor can occur. There are three types of neurofibroma, and I will go more into that onto the next slide. There are three types of neurofibroma. The first one is continuous neurofibroma that develop during childhood or early adulthood. The second one is subcutaneous neurofibroma. This develop around multiple nerves roots, which is associated with sensory motor defects. Diffuse or nodular plexiform neurofibroma develop at birth or during adolescent years. This causes patients to have symptoms because it damages the neural tissue. The epidemiology of neurofibroma is that neurofibroma is a common tumor of the peripheral nerve sheath. It affects both men and women. NF or neurofibroma is highly variable and unpredictable genetic disorder of the nervous system that affects every organ in your body. Signs and symptoms associated with neurofibroma. Most individuals that have neurofibroma are asymptomatic. However, some do develop signs and symptoms based on the type of neurofibroma that they have. Um, the first type of neurofibroma patients have the bone deformity, learning disability, and high blood pressure. In type 2 patient, they have hearing loss, vision loss, and difficulty with their balance. In type 3, those patients experience a chronic pain throughout their body. Each patient will develop a lesion that appears on their neck, their back. Those lesions are localized. They can be painless. They're 2 centimeter. They resemble butthole. They look like butthole. When you palpate those lesions, the lesion retract back into the subcute. Once you take your hand off the lesion reappear back again. Diffuse neurofibroma occur on the head, neck. It has an induration that is thick on the skin. There will be mild numbness and tingling. Plexiform neurofibroma mostly occur on the head, neck, trunk, and extremities. Diagnosis of neurofibroma. A physical examination is done. During the process of physically examining the patient, the physician is looking for a lesion that is called cafe au lait. Cafe au lait is a lesion that appears on the skin. Once that lesion is noted, biopsy is obtained. Once the biopsy is obtained and it's confirmed that the patient have neurofibroma, the physician can also order an MRI just to confirm to see a clear picture of the brain and the spinal cord. They can also do the S100 marker to diagnose neurofibroma. Treatment of neurofibroma. Neurofibroma does not have a cure. The only treatment that is there is surgery, and also pain medication will be prescribed to the patient for management of pain. There are no cure for it. All we can do is just manage the pain. We can do surgery to remove the tumor. If neurofibroma is left untreated, it can lead to complications. The patient will have complete hearing loss, they'll have learning impairment, They will have cardiovascular problems, loss of vision, they will be in severe pain. It can lead to infection. If you can see this picture up here, you can see this picture of wound. They developed a lesion, it wasn't treated, it led to infection. The infection caused this wound to happen. So management, early diagnosis is very important when it comes to neurofibroma.